This is what we're used to seeing in some of our older adults. Walkers and canes help steady many of them as they move from place to place. For many, it's a walk down the street. For even more, it's just a walk to another area of the house. In older adults, mobility or walking can deteriorate with age. As mobility declines, the risk of falls increases. Dr. Amanda Gardhouse is a geriatrician, which is a doctor that specializes in caring for older adults. She sees many patients who have fallen or who are at risk of falling.
I would say with seniors' health, there's a lot of issues that are common to older adults, and certainly as we get older, we're more likely to experience multi-morbidity or multiple diseases. Some of the things we commonly are consulted for or are seen for is dementia, also falls. Bone health is something that also goes up there, and frailty. So, things that have, a multifaceted approach. That's generally what, as geriatricians, that we tend to focus on is a lot of different issues that could be contributing to health issues and health needs.
Falls are the leading cause of injuries that land seniors in the hospital, according to a 2019 report from the Canadian Institute for Health Information. The data collected from participating hospitals across the country shows that roughly 138,000 people aged 65 and older were hospitalized for injuries between April 1st, 2017 and March 31st, 2018. 81% were hurt in a fall. Dr. Gardhouse says the fall is the first clue that something else may be wrong.
There's upwards of 400 risk factors for falls. I like to break it down to things that we're sort of in control of and things that we're not in control of. So things that are intrinsic to us that put us at risk for falls would be sort of chronic health conditions like osteoarthritis, like having had a stroke, like dementia or memory loss. But things that are outside of us that we can probably better control are things like medications we're taking for our diseases, things like alcohol use, and things like the environment. So making sure that everything within the home is nice and safe is key. And we have wonderful colleagues in the occupational and physiotherapy fields that can provide recommendations regarding home safety and environmental safety.
Falls are often caused by immobility and not enough activity. According to Stats Canada, only 14% of adults aged 65 to 79 are meeting the Canadian guidelines of 150 minutes of moderate to vigorous physical activity a week. Being sedentary increases the older adult's chances of requiring assistance for daily living. It also increases the chances of falls.
First of all, yes, falls is not a normal part of aging, so it's really important to know. Most falls risk factors that are identified are modifiable.
Charlene Wells is a physiotherapist with the North Simcoe Muskoka Specialized Geriatric Services Program, a program offered in partnership with Waypoint Center for Mental Health Care. She says immobility isn't just contributing to the risk of falls, it's also a risk of functional decline.
So functional decline basically translates into a decline in what activities they are able to do, their daily tasks that they're able to do every day. So it could be just mobilizing, it could be transferring, it could be getting dressed, it could be bathing. So those functional activities that we all do in a frail senior, it becomes more complex, more difficult, and you'll see that decline over time, so functional decline. So if you notice a functional decline, I would recommend the first thing to do and maybe discuss that with your primary care provider, just to rule out any acute medical concerns or issues that may have developed. And beyond that, with that person being aware of the problems you're having, they can make the appropriate recommendations and refer you on to the care that's needed, perhaps our program, for example, so we can go in and do our comprehensive geriatric assessment and make the recommendations specific to our findings.
So now that we know the problem, what's the solution?
Exercise is key.
Teresa Hind is a kinesiologist with the North Simcoe Muskoka Specialized Geriatric Services Program, and teaching older adults how to exercise is what she loves.
The idea with us is that we're encouraging everybody to be physically active no matter what, so as much or as little as you can, and then also making sure that you come out to maybe a program. It's never too late to get active, and it's definitely going to have benefits that accumulate for you. Our normal program is the CARE exercise program run through SGS, and it's run in several different locations. It's 2 days a week generally for 2 hours long. So it's something that gives everybody a chance to really come in and be a part of a group, to be active, as well as we do some cognitive training, so to kind of make sure that our brain's getting worked as well.
The exercises are simple and using light movements to help get the blood pumping.
And then we're encouraging things like marching on the spot is great. You can change the speed, you can go wide, you can come in narrow. If people are able, we encourage that they would move their arms as well. So things like raising straight up or back, down, coming out to the side and up as able are some other movements that you could try and do.
For those who want to be active, Dr. Gardhouse says find something that works for you and have fun.
Something else that we often use in clinic, but also sort of in general conversation with folks, is that, if you don't use it, you lose it. And so that really speaks and rings true for a lot of folks, that if we're not as active on a day-to-day basis, we're more likely to experience functional decline. So you really have to be very deliberate about getting exercise, about going out there, sort of challenging yourself day to day in order to maintain our strength and endurance as we get older.
And challenging yourself to be more mobile will pay off in your overall physical, mental, and emotional health.